So as a state, California ranks 43rd in the country when it comes to screening infants and toddlers for developmental issues.
Yeah, not a great stat to have. We have two guests joining us to talk about the situation today. Dr. Richard SEIDMAN is the Chief Medical Officer for LA Care Health Plan, and Tara Fitzik is the Director of Health Systems at First 5 LA. Thank you both for being here today.
Good afternoon.
Thank you for having us.
All right, Dr. SEIDMAN, let's start with you. Why do you think California is lagging behind the rest of the country when it comes to these child screenings?
Well, there are many different reasons why we're scoring as poorly as we are. Sometimes it's a simple matter of the way a doctor codes what they write down in the medical record and what they submit for billing in order for their developmental screening efforts to be counted. The grant that we've received from First 5 LA is going to help us train physicians to make sure they're using the right codes, doing the right kind of screening, and so they're aware of the resources that are available to refer children to that have developmental needs.
So either one of you can answer this question here. Is the problem universal, or are you seeing this lag in screening happening in certain neighborhoods? And if so, talk about some of the driving forces.
Terry, you want to go ahead?
Dr. SEIDMAN, I can start. I would say the problem is universal. It's not unique to a neighborhood or a certain region. We see it across California. The data we have shows that across California, only about 30% of children receive timely developmental screening. So it's something that we are looking at statewide. It's not unique to LA County.
And Dr. SEIDMAN?
Yeah, and one of the things that we are doing that the state has made available is if you talk to doctors, among the reasons why some say that the screening isn't happening to the extent that we would like it to, is there are concerns about the time it takes to do the screening and the reimbursement levels, particularly for children who are beneficiaries of the Medi-Cal program. So one of the good things that's been done here in the state is the state has set aside additional funding to better reimburse physicians for taking the time that it takes to do appropriate screening. Again, talk to the families, educate them, and make sure they're aware of the available resources for treatment.
Yeah, tons of outreach, it seems, is really important in all of this. So, Tara, can you tell us a little bit about how First 5 LA is helping with that situation?
Yes, so we stepped into focus on this issue a few years ago, and we looked to LA Care and essentially looked at where are the kids. And the kids are being served by LA Care. A majority of our priority population, which is prenatal to age 5, is a member of LA Care Health Plan. So it seemed a natural fit to be partnering with LA Care on this work. And then when we initiated planning for this work, it really was LA Care that rolled up their sleeves with us, started digging into the data, looking at what are the barriers to screening for providers, where are there opportunities for improvement, and then offered their multiple platforms, such as provider trainings, member communications, such as their newsletter, and then they're using their growing network of community resource centers to focus across all of these platforms to better emphasize and promote early childhood development and better support families in addressing their questions and concerns.
Wow. All right, well, Tara and Richard, we appreciate your time here this afternoon. Thanks for being with us.
Thank you.
Thank you. Pleasure to be here.
All right.